Thank you, Mr. Chairman. Secretary Mackrath, that sounds good. I like that.
Thank you.
I wanted to ask you about the sizable population of folks in Pennsylvania who are eligible for both Medicaid and Medicare. I think they call them dual eligibles, and there may be as many as 400,000 of these folks who are not in the health choices, so their care is really not being managed currently. And I believe they're being taken care of on a fee-for-service basis. So I'm wondering what, if anything, the department is currently doing or should be doing to address that population of folks so that we can better manage their care, which, as I understand, is sometimes high risk, high cost care.
I think there are a number of proposals on the table to take a look at treating the dual eligibles, and actually if we were talking about going down the road with the ACA expansion, that may be something we'd be looking for some help with from CMS on where to go with the dual eligibles. I mean, right now we do provide coverage for them in the fee-for-service program, mainly because they're getting their pharmaceuticals through the Medicare program and the Part D program. So that's an area of treatment that we don't have any control over, or the managed care program doesn't have any control over. But there are several options out there about how to integrate the duals maybe into a managed care approach, and we are receptive and are talking to people about various other options.
Are any of those options including, going to the private sector and getting some managers that do that sort of work?
I cannot tell you. I'm not sure about the details at this point.
Okay. Offline, could you maybe share some of those, the approaches that you're looking at? And I think I still have a minute. The LIFE program, Living Independently for the Elderly, I think it is. Mm-hmm. What is in the budget for that program to enhance it, expand it, whatever?
Well, there's funding in there to continue the expansion of the LIFE program. A number of the LIFE providers came in with an approved number of slots in the program, and we allowed the LIFE providers to grow within those existing slot numbers. We do have funding for 2 additional LIFE providers who actually, it's the annualization. They're providers who came on this fiscal year. We may have included them in a previous year's budget funding, but there was a delay in getting up and running. They came on board this year. We included the annualization of them. Okay. So we do continue to fund growth within the LIFE program.
Okay. Any idea the number of folks that might be affected by the expansion or the dollars that are being committed to that?
There is.
If you don't have it readily available.
We can absolutely get you that.
Okay,
yes.
Great. Thank you very much for your answers, and I think I'm under time. Thank you.